At the start of August, Belize had a total of 56 COVID-19 cases, of which 24 were active. A mere 12 days later, there are 296 cases reported, of which 262 are active. There are many ongoing efforts to slow and eventually stop the spread of COVID-19 in the country. These include promoting washing of hands, maintaining social distance, wearing a face mask, and even lockdowns in specific parts of the country. But another critical element in stopping the pandemic from spiraling out of control is contact tracing. Contact tracing is the process of tracking down each person with whom an infected person has come in contact. A team of dedicated health workers have been trained to investigate the ongoing spread of the disease.
There's a cadre of people that have been trained, and this includes doctors, nurses, um, other support staff like statistical officers, vector control personnel. So it's lab technicians. So it's a wide sector of members of the ministries of health staff.
Many of these officials have had experience as health detectives. That's because contact tracing is routine in public health whenever there is an outbreak, as we've seen with outbreaks of dengue, pink eye, Zika, and even rotavirus. But in the case of this new disease and the way it spreads, their usual approach had to change.
We started looking at what is the safest way for our officers to do contact tracing. At that particular point, we were looking at telephone calls, looking at contacting persons through this medium where you do not have that direct contact with the person because you do not know. We in our world of public health, we are used to that face-to-face interaction. When you're conducting an interview, you want to see the person, you want to get you usually get some hints based on how people behave, how they respond to you, how they look at you. You look at you look at the body language.
Of course, body language helps in gauging how honest people are being in disclosing their contacts. But the experience tracers have been having in Belize is the initial shock of the patient's diagnosis.
I mean, the shock of being told that you're positive and then you asking them might play on their mind a bit, that they, all of a sudden your brains become fuzzy and you can't recall, and you're asking them, okay, um, because you try to establish, okay, more or less, when did you get infected? Who were your contacts? Were you with somebody that was symptomatic? And so that might be like a week ago. Fortunately, some persons have come out and disclosed their status on social media. And so people hear and they know. And so they would call us and said, you know what, I was with this person on such a date.
Not all contacts will be tested, though. That's because in their investigation, the tracers will determine whether someone is a close contact or a casual contact.
Close contacts. These are our priority groups. No, these are the persons that we really want to um, track as soon as possible.
Close contacts include persons you live with, persons you had more than 15 minutes face to face without a mask and less than 6 feet apart, healthcare workers who at the time of contact were not using appropriate PPEs, being in a room in a healthcare facility where an aerosol procedure is taking place, direct contact with body fluids or lab specimens, a passenger within 2 seats in any direction on a plane, and individuals who share a closed space for more than 2 hours but not within 6 feet of one another.
When you look at casual contact now, if it's less than 15 minutes, if you had on your mask, to the persons now who are anxious about why am I not being screened, or why am I not being called to come in for a screening, or why am I not interviewed? Again, as I said, we have done the assessment based on what the person, the case is telling us. If the case is telling us, okay, I saw Marlene at this shop, we just chatted for 2-3 minutes and then I went on my way, we have assessed that and we say, okay, Marlene was a casual contact.
Close contacts of a positive case are the only ones who are required to be tested. The contact tracers are racing against time to determine those persons, get in touch, and get them tested. Because the longer someone who may have the disease stays out there in the public with the virus undetected, the more people they can spread it to. Paris shared that they're noticing that older persons have far less contacts than the young.
you find that young people, people who are out there, the contacts, could go up that we have followed and tested, I think, um, has been 30 to 50 persons, especially if they were, I mean, parties is usually the place, parties and social gatherings.
With the recent spike in cases, more contact tracers have been trained. As they continue with the enormous task of tracing over 200 cases, they hope that the public can help in slowing the spread.
The virus does not move on its own. You move, the virus moves. We need to slow down. And we know people have to go out. We know people have a job to do probably. Every individual has to be responsible for his or her own health at this point.
Since close contacts are most likely to be family, co-workers, and close friends, the Ministry of Health advises the use of masks and social distance, even in these private settings.